That would be bad.
I think she's probably across the hall. Hedgel will know where she is.
Who?
Lady in the white skirt.
Who are you looking for?
She's looking for Mary Dickinson.
Oh. Mary's just out there.
I told him to ask one of them.
I just saw her in the lobby.
Oh, okay, good. Maybe that's. He's a nice guy. I'll just start shooting.
Mary, no, you're going to be over here on this side, Mary. Yeah. The council members can come up here. Yeah. Hey, it's good to see you. Okay, let's get started.
I hear you. A lot of people in here.
I know. Hey, aren't we in violation?
Yeah, seriously.
Okay, let's get started. We're going to do two things today, very quick. Councilman Peck, come on. Councilman Peck, come on. All the council members, come on up. All right, today I've got Mayor Pro Tem Martin, Vice Mayor Pro Tem Castek Tatum, Councilmember Pollard, Councilmember Peck, Councilmember Robinson, Councilmember Kubash, Councilmember Plummer, all with us today. And let me make these comments, and then afterwards there'll be a number of individuals who will be joining me in taking the vaccine. Today, joined by a diverse group of healthcare professionals, frontline essential workers, employees from the city solid waste and public works department, and senior community members who are considered high risk of getting the coronavirus disease. In a few minutes, they will join me to get the Moderna COVID-19 vaccine, a shot in the arm, which is one of the best protections we will have in our fight against the deadly virus. I want to thank the trained clinical staff from the Houston Health Department for coming to City Hall to administer the vaccine today. And I want to thank them for their work over the weekend in vaccinating almost 2,000 individuals Saturday and Sunday. So please give it up to the healthcare staff. I appreciate them taking their Saturdays and Sundays to service the needs of people in our community. And based on the state of Texas Phase 1A and 1B guidelines, everyone here is eligible to get the vaccine. And before we talk more about the vaccine, I want to remind everyone that it's important to keep wearing your mask, washing your hands, and social distancing. And it is important, especially now post the holiday season, for people to get tested. Okay, so if you travel outside of the city of Houston, or if people travel to your home, please get tested. Okay, so testing is still critically important. The wearing of masks, social distancing, washing hands, using sanitizers, all of the things that we've been doing over the last 10 months, please don't stop doing that. Why? Today, the Houston Health Department is reporting 899 cases of COVID-19, bringing the total case count for the city of Houston to 122,331. That's 899 new cases. We're also reporting 2 new deaths for a total of 1,570 in the city of Houston. These are 2 people coming from 2 different families. And so again, we want to be mindful of the impact that this virus is still having. And today's 14-day rolling average positivity rate inside the city of Houston is 13.9%. It's the positivity rate inside. And again, the positivity rate continues to increase. The number of people being admitted into our hospitals continue to increase. And then the ICUs at 100% occupancy. So while there's a lot of excitement about the vaccine, we must keep taking the simple, important steps to stop the virus from spreading in our community. Earlier today, the Houston Health Department launched an online registration portal. You can now go to houstonemergency.org to register, or you can still use the call center by calling 832-393-4220. The response to Houston's first COVID-19 vaccination clinic was massive, quickly filling the appointment slots for the department's current vaccine allocation. The vaccine clinic appointments are booked for the rest of this month, and the department is not taking additional appointments at this time. However, what I will say to you is that we are moving to set up additional sites throughout the city of Houston in the city of Houston. So over the weekend, the Houston Health Department did a phenomenal job opening the city's first COVID-19 mass vaccine distribution site. On Saturday, the health department vaccinated 1,008 people. On Sunday, that number was 986, and today is another busy day. We know there are people reluctant to get the vaccine, but there is still a huge demand, and we will be opening, taking more steps as we get increased vaccine supply. And it is my goal to open up a major mega site this coming Saturday. Director Williams is working on that. Where's Director Williams? Yeah, I wanted to see him as I said that. We're working on setting up that major mega site this coming Saturday, and I know he can get that done. I have all the confidence in him in the world. So, so what I'm saying is that, yes, online portals are filling up, but that's based on the, what we have, the capacity right now. But the work is to expand that capacity exponentially as we move through this week and beyond. So let me just stop there for the moment, and let me first bring on Director Williams for any additional comments that he has, followed by Dr. Peirce.
Thank you, Mayor. I appreciate the opportunity to serve, meeting your challenges weekly, week by week. Even those that are insurmountable, we will do it. I want to keep my job for at least another 2 months, if not longer, but certainly my staff. Well, in all seriousness, what I want to say is thank you to my staff for really stepping up to the plate. Day in and day out, they have not had the holidays available to them to spend with their families and loved ones. They have not even been able to social distance with their families because they've been with their coworkers actually serving people. As of today, we have seen an additional 730 individuals at our Bayou Center site. We do plan to open up testing sites at 4 of our clinics. We are going to be targeting those individuals that are in 1B, although it will be available for those individuals that are in 1A. The individuals in 1B are individuals over 65, those people 16 and above with chronic conditions. If you were out at the Bayou Center this weekend, what you saw was a high demand, but it was a high demand of people who were in that 1B category, and we're grateful for that. As the mayor said, we will continue to look at opportunities to serve. We are actually calling on volunteers to help us to put up that mega site that he is envisioning. We will make it happen. We will try to reach out to ensure that we have vaccine that is available. Although vaccine is available, it is not time for us to let our guard down. We have to continue to wear masks. We have to continue to social distance. We have to continue to test and continue to wash our hands. Really, in just closing, we as a health department are here to protect the H. We are your public health entity, and we will do the best that we can with what we have.
Thank you, Mayor and Director Williams. I just want to echo one of the things that Director Williams said. This is not the time to drop our guard. We got 2 things that are going on now that I think everyone needs to keep as part of their equation. One is there is the new variant virus that started out in England. It is here in the United States. It's in several states in the United States. It's actually in many countries around the globe. This virus spreads much more easily. This variant spreads much more easily. Fortunately, it does not appear to be any more consequential. It doesn't make people any sicker, but it spreads much more easily, so we can expect the number of people to be infected as this virus spreads to get larger and larger and larger. Now, that's really important when you consider that as more people become infected, when we look at our own local data of the number of folks, of the confirmed cases that we know in this area, and you compare that with the number of hospitalizations, it looks like it runs about an 8% chance if you become infected of requiring a hospital bed. And when we look at our hospitalizations, they're going up as well. And the governor has set a threshold of 15% of hospitalized patients are diagnosed with COVID, that is a threshold for the state. And we in this community, we are perilously close to that. Galveston has already breached that. We here in Harris County, and they do it by trauma service areas, or this trauma service area, we are getting very, very close to that. So the point is to reinforce what both the mayor and Director Williams said, is that this is not the time to drop our guard. We can see the light at the end of the tunnel. We need to work diligently to get there. But please, everyone, continue to wear the mask. Even those of you who become vaccinated, you need to continue to wear the mask. Remember, the vaccine is 95% effective. And so you can interpret that a couple of ways. One easy way to interpret that is that for 5% of the people, their immune system just doesn't respond to it. So that means, and you have no idea whether you're one of those folks or not. So until we reach herd immunity, even if you become vaccinated, you still need to wear the mask and you still need a social distance in order that you don't become infected, or if you are infected, that you don't spread it. And remember, the person you're most likely to spread it to is a loved one. So let's keep our guard up. Houston, we've been in tough places before, weather-related events, all kinds of things. This is a marathon compared to those previous sprints, but let's keep it up. I said Galveston has already crossed the threshold. A lot of other places across the state have. Houston, we're not there yet. There's a reason we're not there yet. That's because Houstonians step up. Let's continue stepping up. Do not drop the guard. This is not the time to drop our guard. Mayor?
Thank you, Mayor. I'm going to keep mine short. Mary Benton told me to keep it under 3 minutes. So, first of all, it's good to be up here with all the council members. I'm not sure we have a quorum or not, but the numbers for the Houston Fire Department have continued to go up. Today we are at 256 firefighters that are in quarantine. We have a total of 94 that have tested positive for the virus. And this past week we had our record number of firefighters exposed and testing positive with 54. In total, we've had 509 positive, and 415 of those have come back. So it is placing an incredible strain on our ability to keep firefighters available to serve this community. We ask the community to do their part, to continue to do their part as we roll out these vaccines. And as been mentioned here just recently and by Dr. Person, of course, the mayor, wear your mask, proper distancing, and proper hygiene is going to go a long way for us to be able to fight this virus together as we roll out these vaccines. The fire department is doing their part as well. We received a shipment of Moderna vaccines. We've been making available the vaccine to our firefighters since December 20th. We have vaccinated over 200 firefighters at our fire headquarters. Those are our personnel. In addition to those opportunities that are available to them from Methodist and from St. Luke's, which we appreciate their support in that. That is my report for now, Mayor.
Good afternoon. Thank you, Mayor, for your leadership, and the council members, thank you all for being here, and your leadership as well, and Director Williams and everyone else. The police department is still 100% operational. However, we have 348 members of our department that are out because of COVID. Year to date, we've had 975 members of our department that have been tested positive, and so as you can see, we're no different than the community. We're having a lot of impacts from this, and we're just very grateful that the mayor is exercising leadership to get people vaccinated. I guess today I will be getting vaccinated, and part of it is that there's people that are afraid, but the truth of the matter is that this vaccine is safe, and it's important that we get vaccinated. The more people get vaccinated, the sooner we get them vaccinated, the sooner that we'll be back on the other side, on the other end of COVID. Así que la comunidad hispana, quiero que sepan que tenemos 348 oficiales del Departamento de Policía de Houston que están fuera del servicio por el COVID-19, y esta tarde el alcalde quiere que yo tome mi vacuna. Sabemos que tenemos unas personas que tienen temor, piensan que la vacuna es peligrosa, pero no es peligrosa. Lo más pronto posible que todos tenemos estas vacunas en las próximas semanas y meses, lo más pronto que podemos seguir con nuestra vida normalmente. Así que, por favor, cuando tenga la oportunidad y es su chance, por favor, tómese la vacuna. Thank you.
Let me thank all of them, and let me just say, testing, all of the other medical protocols, taking the vaccine, and then let me just say to all the people in the city of Houston, in 1B, in Category 1B, across the state of Texas, that's about 8 million people in Category 1B. That's about 8 million. And of course, we can't do all 8 million at one time, okay? So it is a process that we have to work through. At the same time, there are a lot of people who are reluctant. And I will tell you, in walking through the clinic on Saturday and Sunday, what was noticeably absent in many ways was the number of the people of color who were not in those lines. And I spent a lot of time at the clinic Saturday and Sunday, but did not see that many Hispanics and African Americans. So today, I am pleased, and Asians. Let me include that as well. So today I'm pleased to be joining us today in taking the vaccine. Of course, Chief Acevedo, Chief Pena, Judge Sandhill will be joining us today. Mary Ramos will be joining us today. And then there, Pastor Lawson will be joining us today. And he's simply amazing. We asked him about taking it at the clinic, and he said he wanted to come here today. So thank you, Dr. Lawson, for being present. Appreciate that. And then we have Savannah Wong, who is a community member, Zinji Wu, a community member, Jose Higoreta, who is with our solid waste management employee, Stephen Fowler with the solid waste department, Kennedy Tolliver, public works employee, Paul Jones, a public works employee, will be taking it today. So a mixed group, and of course I will be taking it today. So, and then Council Member Kubosh will be taking, and for one of the few times he's taken off his tie, so he is ready to go. And then I'm going to be taking today, and let me just say in advance now. You know, I do work out, so when I take off my coat, I don't want. I barely got in this shirt, you know. But I try not to eat too much today for the muscles to go down. Yes. I just said. But the point is, for people of color in our community, in this diverse community, this is not the Tuskegee Project. We recognize the hesitations people have, the fears that they have, but while many people are coming to get the vaccine, this is not the time for people of color to be staying away from the vaccine. So we want to encourage people in the Hispanic community, people in the African American community, people in the Asian community, people in all of our communities throughout the city of Houston to take it, because until we get to that 75–80% herd immunity, we're all going to be adversely affected. So this is another time for for the most diverse community to come together like never before. And then we want to work very closely with our federal, state, and local partners in order to put together a seamless system so that we can get this vaccine out as quickly as possible. I want to thank these council members, because eventually they're all going to be taking it. Dr. Plummer is one of our providers.
I'm taking it today, too.
So she's going to be taking it because she's one of our providers, and so to be taking the vaccine. So let's get it done. And then, of course, the way this process works, you get it done, and then they have to monitor you for 15 to 30 minutes, depending on your medical status. So I'm going to take it, and then I'm going to turn around and administer the vaccine to Councilmember Kubosh. Okay, so tell me what I'm doing. Will y'all direct me? Oh, I'm sorry. Okay, questions?
No, we're good to go.
Okay, well, I'm saying, while we're doing that, if you all would go ahead and get the first group's position to take it just as soon as the question, then I'll come in. Just save my spot.
Yeah, save that spot for
Okay.
Okay, Mayor, the vaccines provided by Houston Health Department, are they for Houston residents only, or can people from surrounding communities come and take
I would
them?
say primarily for Houston residents. We're working in we're closely coordinating, for example, with the county. So just like last week, we provided doses to the county at their request. So Harris County and the city of Houston are working in close coordination with one another. If there's a shortage at one end, then we assist, and vice versa.
Okay, and where does the average person go to qualify, or where do they need to, who do they need to talk to?
If they are call or go online,
Can they go through their own doctor?
Oh, if they can also go through their own doctor to get the vaccine, if their doctors have it. Now, a lot of these vaccines are at the various hospitals throughout, for example, throughout the city of Houston, throughout Harris County. So if they can either get it through their hospitals, they can get it through their doctors, they could call the Houston Health Department, or they could go to a number of the providers throughout the city of Houston.
Okay, a luxury Houston condo made news over the weekend. 60 residents got the COVID-19 vaccine.
Who was that? I missed that first part.
It's a luxury Houston condo.
Oh, okay.
Are they taking vaccines away from other people that need them, or do you know how they got them?
That I don't. They didn't get them from me.
Okay.
Director Williams, do you know?
You know, we've heard about that, but it was my understanding that it might have been a luxury condo, but it was actually a condo that was inhabited by individuals that were seniors. So,
Okay.
yeah.
Okay, and we're nearing the threshold, the governor's threshold. Will you close bars again and restaurants if you have to?
That's the governor's mandate, that if it's 15% or more, the hospitals are COVID, and if it's for 7 consecutive days, then they must roll back. Restaurants must roll back to 50%, and bars should close. So that's the governor's mandate.
Hey, I have a question, Mayor, over here on TV.
Okay.
Either for you or for Dr. Pearce. Do you guys know, or is there any information regarding if the Pfizer or Moderna vaccine would work for the new strain of the virus?
Dr. Pearce? I believe the answer is yes, but...
The mayor is correct.
Oh.
When we talk with the folks that we're talking with that develop vaccines, people like Dr. Hotez, for example, they are highly confident that it will work on the new strain.
Okay. Does anybody need me to do anything in Spanish?
Oh, Mayor, I did have a question. Regarding that 15% threshold we were discussing, so it looks like we're getting relatively close. How close are we getting, and would you examine getting a curfew if necessary?
Well, number one, the governor has challenged the curfew that was put in place by Austin and Travis County a week ago. Took it all the way up to the Texas Supreme Court, and they said that Austin could not go contrary to the governor's order. The Attorney General Paxton challenged. The governor spoke against the curfew. So that would be an excellent question to give to the governor.
Is it concerning knowing that we're getting closer to that threshold?
I'm going to let you all direct those questions to the governor. He's driving the ship. We're simply a passenger on it.
Okay, and also as far as volunteers assisting, who are you calling upon to assist with the vaccine?
Director Williams, volunteers? Okay, we're reaching out to various groups, so if there are individuals who want to assist, especially on the mega site that we will be opening up on Saturday, please contact the health department.
Thank you, Mayor.
Okay. Okay. Let's do these shots. Okay. Let's take these shots right quick.
He understands what he's saying.
Are you needing a handheld, or do you want to stand or something?
Well, I was just going to say flat.
Ready? Because
So you feeling okay today? Oh, okay.
No problem, like,
you know, come in the doses too, so you're gonna get one today, and the next due date is gonna be on the 1st. 2 to 1.
I'll hold it. Okay, thank you.
Oh, yeah, I'm not bad. Okay. Let's make sure.
What happened? You hear me here?
Wow, that was a good job, man. You didn't even play.
Is that it?
Thank you. Okay.
Next.
Okay. Right there.
How was it? Feel better?
I feel invincible.
I just put it up there. Okay. You want to take notes?
Yeah, right arm or left arm? Okay.
Okay, so we don't have... Did you fill out your packet? Your packet? Do you have this one?
I don't have that now.
Hey, need some sun, bro.
I'm sorry, I need your packet.
Over here for 15 minutes?
Yes, ma'am.
No idea. Should I go around that way?
I'm holding up the train, so let me fill it out right there, too.
Okay. While you are doing that, I'm just going to do... He's holding you. Okay. Pass the law to them losses.
Okay, what else here? All of this?
No, just here. Okay? And go ahead and sign here for me. And then go ahead and answer these questions.
I'm sick. No, we already had COVID-19 vaccine. No. No. Okay. And then what?
Ecclesia. Ecclesia. He did. Can you help me?
Is this sufficient? Is this sufficient? Oh my God. Sit down.
Push it down. Yeah, Doc.
Yes, for sure.
How are you?
I'm fine. How are you doing today?
Good. Thank you all so much.
Thank you.
Okay.
Doesn't matter which arm I take
No, which one do you prefer? So you can go to whichever arm you don't mind a little muscle achiness, muscle pain in it. Yeah.
Okay.
That is high enough. As high as we can get it. Yes. So they'll be explaining that you might have some pain.
No, but I figured as long as it's not as bad as tetanus.
All right, and you're immunocompromised?
Yeah, stem cell recipient.
Okay. Let me see you here.
Now, how do we know about getting the second shot?
So I'm going to give you this little card here, and it tells you February 1st to 21st, and I'm going to write the number you can call, but it will probably give you more information. And then you do have to do observation for 15 15 minutes. I was about to say 15 seconds. You ready? All right, you ready?
No, I didn't know they had to fill all this out.
All right, you ready? 3, 2, 1.
When the mayor says to give me the shot, I thought that was sufficient. I thought when you said give me the shot, that'd be sufficient. You was going to give it to me. Here you go.
Appreciate you guys. Thank you.
You need this pen?
I got it. Thank you so much, Mike.
I'm really sorry.
Help me out a little bit here.
Mayor, you going to give